Welcome to the COVID-19 Vaccination Making an Informed Decision e-learning module. This module was created with generous support from Lakeridge Health with content adapted with permission from Sunnybrook Health Sciences Center. We are committed to the safety of all of our staff, residents, essential caregivers, and visitors, which includes protecting our population from COVID-19. Along with our existing public health and personal protective measures, the COVID-19 vaccine is the most effective way to prevent COVID-19 infection. This e-learning module is intended to provide you with the most accurate and up-to-date information you need to make an informed decision regarding immunization. This module does not focus on a specific COVID-19 vaccine, as all of the vaccines currently approved by Health Canada are safe and effective. Over 174 million people worldwide have documented infection with COVID-19. Over 3.75 million people have died from COVID-19 since the beginning of the pandemic, making it the fourth leading cause of death globally in 2020. Ontario has seen over 250,000 important surgeries delayed. In addition to this tremendous impact on our healthcare system, COVID-19 has affected us on a personal level with restrictions on many daily activities, most importantly, on our contact with friends and loved ones. COVID-19 does not just impact older people. As more older individuals get vaccinated, and with the highly transmissible COVID-19 variants of concern on the rise, the demographic of those impacted by COVID-19 is now younger adults. These variants lead to a 4 times higher risk of intensive care unit admission and double your risk of death. We can't predict who may experience the most serious complications of COVID-19. During Wave 3, more than 45% of all hospitalized COVID-19 patients were younger than 60. Many patients, including young and previously healthy people who had COVID-19, are experiencing long-term complications. We're seeing struggles with memory, fatigue, body aches, and heart and lung damage that are lasting for months. Everyone who gets COVID-19 gets it from someone else. If you get it, you may be fortunate and have a mild case, but what's minor to you could be devastating for someone you pass it on to. The COVID-19 pandemic has also disproportionately affected racialized communities across Ontario and the country. There has been disproportionate representation of many racialized groups among people with COVID-19 infection and those who require hospitalization due to the illness. There are many benefits of vaccination for ourselves, our loved ones, our residents, and our community. For ourselves, the COVID-19 vaccine substantially reduces your risk of becoming infected with COVID-19. If you do get COVID-19 after you are vaccinated, it will decrease the severity of the illness. For our loved ones and our community, one of the major benefits to staff immunization is achieving community immunity within our population. We depend on each other for community immunity. No vaccine is a guarantee, but it's our best defense to protect ourselves and everyone we come into contact with. Your vaccine might stop COVID-19 from reaching someone who won't survive it. The sooner we get to community of herd immunity, the sooner our lives can begin to go back to normal. For our residents, every choice we make right now either increases or decreases risk to ourselves and everyone we come into contact with, and everyone they'll come into contact with. By taking steps to protect ourselves, we help keep our residents, colleagues, and loved ones safe. Given they live in a group setting and may have underlying medical conditions, residents are at increased risk for contracting the COVID-19 virus and experiencing serious outcomes. High rates of vaccination in our home is important to protect all people who live in, work, and visit it and to help reduce the risk of outbreaks and the need to isolate residents. Isolation means residents lose in-person social interaction and the ability to engage in activities. The effects of isolation may be greater for residents who have dementia and/or a cognitive impairment. Recently released guidance issued by the Ministry of Long-Term Care permits communal dining and indoor activities to resume with precautions in accordance with COVID-19 Directive Number 3 for long-term care homes under the Long-Term Care Homes Act 2007, issued by the Chief Medical Officer of Health. The Ministry of Long-Term Care guidance indicates that when at least 80% of residents and 70% of employees are fully immunized, some measures and precautions, such as physical distancing requirements, are further lifted during these activities, which supports resident well-being. Although we will respect your decision about whether to be vaccinated or not, we strongly encourage you and all people working in or otherwise attending our home to help protect everyone by getting vaccinated. We will support you in getting access to vaccination. COVID-19 vaccines work by training your body's immune system to recognize and fight the virus that causes COVID-19. mRNA vaccines teach our cells how to make a protein that will trigger an immune response without using the live virus that causes COVID-19. Once triggered, our body then makes antibodies. These antibodies help us fight the infection if the real virus does enter our body in the future. How do mRNA vaccines work? Scientists generated an mRNA sequence that codes for the virus spike protein. mRNA is a molecule that our body normally uses as the instructions to make all of the proteins in our body. The RNA sequence, a blueprint for making the spike protein, which is present on the surface of the virus, is carried in a lipid or fat coating to help it enter the cells. Once it arrives, it enters the muscle lymph node cells near the vaccination site, which read the information in the mRNA sequence to produce millions of copies of the spike protein. The protein fragments spur the immune system to produce antibodies that can protect when a real virus enters the body. The vaccines currently approved for use in Canada have been shown in clinical trials to be highly effective, between 70 and 95%, at preventing even mild infections with the COVID-19 virus. Even more important, in clinical trials, they are 100% effective at preventing hospitalization and death from COVID-19. Real-world data from countries that have been vaccinating since late 2020 show a dramatic decrease in hospitalizations related to COVID, despite society opening up and many public health restrictions being lifted. For instance, data from Israel 6 months after rollout of Pfizer-BioNTech COVID-19 vaccine showed a 97% effectiveness against symptomatic illness, 92% against asymptomatic infection, and 97% protection from hospitalizations and death. In Ontario, the vaccination of over 90% of residents and 55% of staff in long-term care homes is estimated to have reduced COVID-19 cases in residents by 89% and by 79% in staff after just 6 weeks. It is estimated that the risk of death in long-term care residents had decreased by 96%. At the University of Texas Southwestern Medical Center, with 78% of the staff vaccinated, the incidence of COVID-19 infection in staff decreased by 98%. Similar results were seen with vaccination efforts at large healthcare centers in California and Israel. Vaccine effectiveness is estimated to be 60 to 80% for preventing COVID-19 infection 3 to 4 weeks after receiving a single dose of vaccine. Following the second dose, vaccine effectiveness increases to greater than 85%. While vaccines provide a high degree of protection from COVID-19 infection, it is expected that a small proportion of vaccinated individuals may become infected, as no vaccine is 100% effective. When COVID-19 cases occur following vaccination, there is evidence that vaccines reduce symptomatic infection, the severity of illness, as well as transmission. The vaccine effectiveness for the prevention of serious outcomes, such as hospitalizations and intensive care unit admissions, ranges between 70 to 90%. Of the over 6.5 million vaccinated individuals in Ontario, only 0.15% became infected when they were partially vaccinated, and only 0.02% became infected when they were fully vaccinated. The majority of post-vaccination cases identified were not yet protected from vaccination when they acquired their infection, as their symptom onset date was within 0 to 14 days following dose 1 administration. How were the COVID-19 vaccines developed so quickly? Creating a new vaccine typically takes years. However, the COVID-19 vaccines were developed quickly for many reasons, including being informed by decades of research on other strains of coronavirus prior to COVID-19, such as Middle East Respiratory Syndrome and SARS-CoV. Advances in science and technology, international collaboration among scientists, health professionals, researchers, industry, and governments, and increased dedicated funding. In Canada, drugs, including vaccines, are regulated under the Food and Drugs Act and regulations. They must meet the regulatory requirements for safety, efficacy, and quality before they can be approved for use and distribution in Canada. The federal government, Health Canada, is responsible for approving vaccines. Before authorizing a vaccine, Health Canada assesses the scientific and clinical evidence, including results of clinical trials, to determine if a vaccine product is safe, effective, and manufactured to the highest quality. Safety and efficacy of the vaccine to determine that there are no concerns the vaccine can trigger an adequate immune response to protect against disease and the benefits outweigh the risks. Manufacturing process to make sure the manufacturer can carry out the necessary quality controls for the vaccine. If there is not enough evidence to support the manufacturer's safety, effectiveness, or quality claims, Health Canada will not authorize the vaccine and the product cannot be sold in Canada. All steps to evaluate standards of safety, efficacy, and quality were met in the approval process used for the COVID-19 vaccines. There were no serious side effects reported in the vaccine clinical trials. Ontario makes sure vaccines remain safe for Ontarians by securely and safely transporting and storing vaccines at required conditions and temperatures, establishing safe clinic spaces to give people immunizations, including providing the required training to those administering vaccines, and monitoring for any adverse reactions or side effects that may occur after vaccination, and taking appropriate measures, including working with the federal government and other provinces and territories. Once a vaccine is in use, Canada has a strong vaccine safety monitoring system to alert public health authorities of changing trends or unusual adverse reactions that were not previously reported. As of May 21st, 2021, over 20 million doses of the COVID-19 vaccine have been administered across Canada alone, and over 1.9 billion doses have been administered worldwide. In Canada, only 1,126 serious side effects were reported. That means a serious adverse event rate of 0.006%. This is safer than commonly used medications like Advil and Tylenol. In Ontario, after over 9 million doses given, only approximately 70 serious adverse events or anaphylaxis were identified. As with most vaccines, some people can develop mild side effects like pain at the injection site, fatigue, headache, chills, fever, or muscle pain in the days following immunization. Side effects are more commonly reported after the second dose. These mild side effects typically resolved within 48 hours and are a sign of your body creating an immune response and not a sign of infection. Overall, no matter how unlikely you personally think you are to get sick from COVID-19, you are far more likely to get sick and have complications from getting COVID-19 than you are from getting the COVID-19 vaccine. The Pfizer-BioNTech COVID-19 vaccine and the Moderna COVID-19 vaccine are both mRNA vaccines authorized and available for use in Canada. Getting the same vaccine for your first and second doses, or getting one vaccine for your first dose and a different vaccine for your second dose, also called a mixed schedule, are both considered valid options. Both schedules will count as a full series. Consider talking to a healthcare professional for help in understanding information related to each vaccine to help with informed decision-making on vaccination. The rates of serious reported side effects, like Bell's palsy, that were seen in the clinical trials, 4 of about 22,000 people, are consistent with the expected rates of Bell's palsy in the general population. Therefore, it does not suggest that it was caused by the vaccine. Serious allergic reactions or anaphylaxis after receiving the COVID-19 vaccine have been reported at a rate of 0.004%. This rate is consistent with other commonly administered vaccines like the flu shot or shingles vaccine, and is much lower than the rate of anaphylaxis to common medications like penicillin. There have also been some reports of blood clots related to a specific COVID-19 vaccine made by AstraZeneca. This complication is very rare, estimated at 1 per 55,000 first doses administered. Despite this low risk, Ontario is no longer offering first doses of the AstraZeneca vaccine because we are fortunate to have access to mRNA vaccines, Pfizer and Moderna, that are not associated with this rare blood clot. It is important to know that getting infected with COVID-19 increases the risk of blood clots to as high as 1 in 5 in hospitalized patients. Therefore, being vaccinated will prevent many blood clots. There have been some reports of myocarditis and pericarditis following vaccination with COVID-19 mRNA vaccines. However, the reporting rates of myocarditis and pericarditis are very low at 1 per 100,000 doses of mRNA vaccines administered in Ontario. Remember, as we vaccinate millions of people worldwide in a short period of time, there will be bad events that coincide with the timing of vaccine administration due to chance alone, like getting into a car accident after being vaccinated. That does not mean that these bad events are caused by the vaccine. However, scientists and regulators continue to monitor for any connection between any bad event that coincides with the administration of the vaccine. Overall, no matter how unlikely you personally think you are to get sick from COVID-19, you are far more likely to get sick and have complications from getting COVID-19 than you are from getting the COVID-19 vaccine. As of May 28, 2021, there have been over 1.3 million cases of COVID in Canada and almost 26,000 deaths in people of all ages, a case fatality rate of approximately 2%. It is also becoming more recognized that many patients who have had COVID have at least one persistent symptom 6 months after infection. This is called long COVID. By comparison, over 20 million doses of the COVID-19 vaccine have been administered in Canada as of May 28, 2021. The serious adverse event rate for the COVID vaccine is less than 0.006%. Even if you have been previously infected with COVID-19, it is recommended to get the vaccine, as it is currently unknown how long you are protected after infection. Therefore, getting the vaccine decreases the risk of a reinfection with COVID-19 and also provides protection against variants which you may not have been exposed to. Getting your vaccine is an important step in ending the pandemic. It is safe and effective. We can already see the impact the vaccine has had on the population. In the first 2 waves, the elderly were impacted disproportionately with the virus, but this has changed significantly throughout the 3rd wave. Those over 75 are accounting for fewer and fewer cases, and now a majority of the infections are happening among younger ages who have yet to have broad access to the vaccine. You are eligible to receive the vaccine. Please take full advantage of this opportunity. The benefit of getting the vaccine for yourself, your family, our residents, and to society are immense. It is becoming clear that getting vaccinated will be key to returning to many of the things we miss most. Please consider getting the vaccine. Protect yourself, protect your family, and help bring back whatever it is that you've missed most this past year. To get your COVID-19 vaccine in Ottawa, visit the Ontario COVID-19 vaccine booking website. You can also visit any of the city-run clinics for a first or second dose of the COVID-19 vaccine.